Hi, my name is Jacintha Bell. I'm an occupational therapist and a director of Lifeworks Occupational Therapy. And I'm here with Mitchell Furness today. And I'm going to ask him a few questions about his work and what he's passionate about. So thanks for joining me today, Mitch.
No worries.
I'd just like to ask you first, can you describe your role within the practice at Lifeworks Occupational Therapy and what led you to focus on neurodivergence and chronic pain?
Yeah, so I'm a level 2 occupational therapist at Lifeworks. What drew me to Lifeworks was, and OT in general, was really a passion for innovation and advancements in technology and trying to utilize those to give people the best health outcomes that they can have. My passions are really at VR and AI and biofeedback and electrical neuromodulation, and Lifeworks certainly offered and encouraged me to explore those. And I think they're very forward thinking in terms of how can we get the most for the clients, and not getting too stuck in old ways necessarily.
Oh, great. Yeah. So lots of new ways of applying therapies and finding new ways for people to basically be able to live their life well.
Yeah, I think so, because I think there's so many advancements in technology nowadays, and often them being applied to health comes as an afterthought, which is a shame. And so I think there's a lot of missed opportunity, and with the direction that we're going and the advancements that are happening so rapidly, it's that's definitely my passion, is to try and apply those so that we can use them for good.
Ah, great. Okay. So can you tell me what your approach is to treating clients either in the neurodivergent space or clients with chronic pain, and how you tailor your interventions to the needs of the individual?
Yeah, so I firmly believe in taking a collaborative approach with my clients. I don't see it as being you come and see me and I tell you what to do and you go away and do it. It's us working together to get you back to doing what's most important to you and what's most meaningful in your life. I come with my own level of expertise, but at the end of the day, every client is the expert in their life, and giving them that ability to be able to problem solve for themselves in the future is really what I aim for, so that hopefully one day they don't have to come and see me. They can manage, some of these challenges that they're facing themselves. And certainly with that in mind, it's always an individual and unique approach to each person. What's important or meaningful to everyone is different, and what challenges and barriers they're facing is also unique and different. And so trying to have that where it is us meeting as equals on the same playing field and trying to work as a team to achieve those goals is certainly how I try and approach therapy.
Yeah, that's wonderful. Certainly no cookie cutter approaches there.
Yes, no, definitely not. No.
Yeah, and definitely trying to do yourself out of a job so that people don't actually.
Yes, it's a tightrope I'm walking.
Yeah, that's awesome. Great. Can you share a success story where your intervention significantly impacted a client's quality of life?
Yeah, I had a client that I'd been seeing for probably 6 months or so just recently, and he originally came to me with sort of presenting with much that neurodiversity sort of cluster of diagnoses, ASD, ADHD, anxiety, depression, and he'd been struggling for a few years with the transition post high school and into that next step of life, which I think is echoed with a lot of similar people, and had been struggling with trying, had attempted to go to TAFE on a number of occasions, and it hadn't been successful. And so we started working together very much with that as a goal in mind, and worked through some organizational systems and ways that he could better manage his emotions when he's going to uni and the lead up to it, and addressing some of those barriers he was finding, and working together. If we try and attempt a solution, it wouldn't work sometimes for certain reasons. We go back to the drawing board, take that new information on board and try again. And over those sort of 6 months, he was able to re-engage with his TAFE course, and was starting to enjoy it, and had attended every class and was getting himself there. He was better able to manage his fitness and his general organisation, and recently reached a point where he sort of felt like he was able to problem solve a lot of those issues that were coming up now. And certainly for the last couple of sessions we had was often me giving him the space to explore solutions himself, and he was largely coming up with them. So it was nice to see that full circle, I suppose, that he felt that confidence to go away. And then, if need be, he faces a problem that he feels he can't solve, then, he can come back and have another session with me and we can problem solve that. But it was nice to see that, that he was able to implement some of those changes, and get back into doing, what was really important to him. And, the benefits that had for him was quite nice to see.
Oh, that's wonderful. Being able to help somebody to make that transition from school to university.
Yeah, definitely.
Yeah,
it was nice.
Fantastic, great. What can a client expect, do you think, when they first come to see you? What is the process that you use, and how do you support them through their journey?
Yeah, I try and make it as comfortable as possible, and I think it's important to initially get a feel for who we each are as people, because I think it's really important that the therapist and client relationship is one where you get along, because I think if that's not there to begin with, then it's really hard to get any real therapeutic gains. So I try and get a better understanding of them as a person, and try to let them in on who I am as well, so that we can try and meet, like I said earlier, as those equals, and get a sense of what life is like for them, and who the important people in their life are, what is meaningful and important to them, and what are they not able to do at the moment, and how can we get them on a path to doing that. So often, a first session might be that they come in and we discuss some of their goals and some of their challenges, and identify potentially a roadmap of how we might get them to engage in the things that they want to, and then, as always, that roadmap sometimes change and the goalposts shift, but always having that open and honest communication around, okay, how are we going to do this, and identifying what's the role that they are going to need to be able to play in the therapy process, and where I will play my part, and try to very much encourage them to have a voice in how we do things. If I encourage them, if I make a suggestion and they're sitting there going, that's not going to work, I encourage them to tell me, no, that was a bad idea, it's not going to work for this and this reason, and then we can go from there. That's certainly how I try to make them feel comfortable, that they can feel like they can have that back and forth, and it's not just walk in, sit down, I tell them what to do and then they leave. Certainly not the approach I try to take.
Yeah, that's great. Sounds like very much developing a mutual understanding, and definitely a very client-centered approach, where you are not sort of putting yourself as the expert, but rather the client is the expert in their own life and their own experiences, and you're just helping guide them.
Yeah, certainly the analogy I like to use quite a bit with them is I'm the pit crew and they're the F1 driver. They're the one at the end of the day that has to drive the car and make the decisions, and I'm here to provide the support that they need, but certainly I'm not the one that can drive the car. They're the ones that has to do that past therapy sessions for the rest of their life. So certainly the approach I try and take.
I love that analogy, Mitch. Yeah, that's awesome. Okay, so why do you believe our practice is the best choice for individuals who are dealing with neurodivergent, or have neurodivergence, or who are dealing with chronic pain?
Yeah, I think that I might be a little biased, but I think we have some of the best OTs, and I think the way we approach our therapy is very client-centered on a whole, and we try to provide the best level of care that's both evidence-based and personalised for the individual. And I think that at Lifeworks, we definitely encourage people to explore what their areas of interest is and what their strengths are as a therapist. And so we're able to find a better match, I suppose, sometimes between a therapist and a client. And we have that continual search for knowledge and doing things in the best way we possibly can, using innovative technologies and approaches, which I think gives gives us a bigger toolkit to try and apply to the problem that the person's facing. And so I think has a better chance in some regards that, we're going to find the right fit and get them the outcomes that they're looking for.
Yeah, that sounds wonderful, Mitchell. Thank you so much for your time today. And if anybody's been watching this and interested in getting more information, you can head to our website, www.lifeworksot.com.au, and have a look at the offerings available there. Thank you.